Thank you so much for this kind invitation to be here today at this ICP 80th conference. The title of my presentation is Our Health and the Health of Our Planet. What is the potential role of healthcare professionals? And of course, in here, I include us all psychologists. So I'm going to make this presentation having as a backdrop the Sustainable Development Goals. And considering the fact that what I can present here and what we can do can have an impact on good health and well-being, but can also have an impact on zero hunger, can also have an impact on reduced inequalities, on responsible consumption and production, as well as on climate action. So there's a lot of things that we can do that can have an impact across many different sustainable development goals. This is the outline of my presentation. I'm first going to talk about the threat of climate change, then health impacts of climate change, the case for sustainable production and consumption, the potential role of healthcare professionals, and then a conclusion. So in terms of the threat of climate change, we all know that climate change is already here and is already causing a lot of humanitarian crisis in many different continents of this planet. We all remember what happened in Pakistan and the Pakistan catastrophic floodings. We also recall the floodings in Europe, in central of Europe. This is an image from Germany. We also recorded a severe drought in Europe in August 2022, this year, that impacted rivers, that impacted transport, as in Europe a lot of transport is made using the rivers. And we also know that forest fires are becoming more and more prevalent in countries in the northern hemisphere that we wouldn't expect to happen. It's not only Portugal, Spain, Greece, Italy, it's also coming more and more up north. So in terms of the health impacts of climate change, the Centers for Disease Control and Prevention in the United States created a fantastic model that you can see here. Rising temperatures, more extreme weather conditions, rising sea levels, increasing CO2 levels are going to, of course, have an impact on air pollution, are going to lead to changes in vector ecology, can increase allergens, can increase severe weather, extreme heat, environmental degradation, water and food supply impacts, as well as water quality impacts. All of this will then have an impact on many outcomes, many health outcomes. For instance, air pollution can have an impact on asthma and cardiovascular disease. The change in vector ecology can lead to further spread of diseases such as malaria and dengue. Increasing allergens can lead to exacerbations of asthma, respiratory allergies, and of course severe weather can lead to injuries, fatalities, mental health impacts. So there's a lot that can happen in terms of the population health through impacts of climate change. Now I'm going to talk to you a little bit about the case for sustainable food production and consumption and why this is important. The first thing to take into consideration is that food production, distribution and consumption accounts for 26% of all global emissions. Of these 26%, 18% are linked to the supply chain, 31% to livestock and fisheries, 27% to crop production, and 24% to land use. If we were to remove from this image all that has to do with livestock and fisheries, crops for animal feed, and land use for livestock, we could reduce emissions from food production and distribution and consumption by 52%. This figure represents the greenhouse gas emissions across different food products. Here we note that 1 kilogram of beef from a herd leads to the emission of 60 kilograms of carbon dioxide. We can also note that carbon dioxide emissions from most plant-based products are as much as 10 to 50 times lower than most animal-based products. Nuts, as you can see in this graph, have a negative land use change figure because nut trees are replacing croplands and carbon is stored in the trees. Relevant. And we also know that red meat consumption is related to all-cause mortality. Increasing amounts of red meat, and particularly of processed meat consumption, are associated with, on both men and women, increased risk of total mortality, cardiovascular disease, colorectal cancer, and type 2 diabetes. And this association persists even when controlling for all sorts of potentially confounding factors. Lancet published a diet for planetary health, as I'm sure many of you know. In this report that they published in Lancet, they recognized that an integrated agenda for food in the Anthropocene recognizes that food forms an inextricable link between human health and environmental sustainability. The belief is that the global food system must operate within boundaries for human health and food production to ensure healthy diets from sustainable food systems for nearly 10 billion people by 2050. So the plates that you see here in this slide are examples of a planetary diet. This is a flexitarian diet, which is largely plant-based, but can optionally include modest amounts of fish, meat, and dairy foods. As you can see, this is the planetary healthy diet plate. Half of it is vegetables, mushrooms, fruit. Then we have whole grains, plant-sourced protein, for instance, beans, nuts, unsaturated plant oils, for instance, extra virgin olive oil. Then it comes animal source protein, as well as dairy foods, and finally some added sugars. Of course, we should also add here water, what should be our main source of hydration, indeed. The EU goals are to reduce the environmental and climate footprint of the EU food system and strengthen its resilience, to ensure food security in the face of climate change and biodiversity loss, and to lead a global transition towards competitive sustainability from farm to fork and tapping into new opportunities. So based on this, they developed a strategy, which is the farm to fork strategy. And a colleague of mine and myself have looked into this strategy. And this strategy really thinks that not only we need to have a sustainable food production, but also sustainable food consumption, and a sustainable food processing and distribution, and food loss and waste should be prevented. We entered more in depth and delved more in depth into this policy and analyzed it. And although the actions proposed in this strategy address some relevant psychological mechanisms, these actions are vague and based on only a small number of behavioral determinants that might limit the effectiveness of this strategy. Besides, the implementation of this strategy might benefit from concepts that come from psychology, behavioral science, and implementation science in order to increase its acceptability and feasibility to reach the ambitious goals of this strategy. We believe that in order to successfully translate this strategy from paper to reality, active engagement with different stakeholders is crucial. And in this paper, we provide a set of recommendations for policymakers, researchers, and stakeholders alike. For researchers, we say engage with stakeholders and policymakers and test measures and initiatives for their acceptability, feasibility, and effectiveness in real-world settings. The QR code that you see here is one that you could use to engage in providing feedback to the European Union on different policies that they put forward for their population. So the potential role of healthcare professionals. Let's delve into it. So what are the opportunities that I see in terms of engagement between ourselves and our patients, customers, clients, however we want to call them? We know that there are millions of consultations worldwide at any given minute. There are people seeking help for all sorts of issues, often associated with behaviors that can be changed. We know that healthcare professionals healthcare professionals and patient relationship is based on mutual trust. We also know that from research already available that healthcare professionals understand the relation between climate change and health and want to do more with and for patients. And you can see this in this paper, though they also observe several barriers. One of such studies was a survey with more than 4,500 healthcare professionals. And the results indicated that they acknowledge that the health of the population has already been adversely affected by climate change by a moderate to a great amount. And this will become even more frequent or severe in the next 10 years. Health effects that were targeted in this survey were plentiful, as you can see here in this figure. And you can read at your earliest convenience. But things like anxiety and depression, other mental health conditions, physical and mental health harm from forest fires, from hurricanes, all of this was targeted here. Healthcare professionals also ask for extra training so that they can be more effective on addressing climate change and health, and they also ask for patient-facing educational materials. In order to further support healthcare professionals and develop interventions that are effective, and in order to develop patient-facing educational materials, we need to understand better the behavior that we want to change. And if we want to change the behavior of healthcare professionals, it is important to understand what are the factors, the barriers and facilitators that are determining the implementation of new strategies or new interventions and approaches. The theoretical domains framework is a behavior change tool that is crucial to investigate clinical practice implementation problems. It was based on many different theories of behavior change and that aggregated all these key concepts within these theories into overall aims. Analyzing these domains, I believe we can all see ourselves in it, how social influences influence what we do, how our own image as a healthcare professional and what we believe to be our role, identity, lead us to engage in different things. So this is a crucial tool that we already have available and that we can use to understand a potential problem, but also to map out determinants of behavior and potential behavior change techniques. And there are already studies that test what is the best way of motivating people to increase consumption of vegetarian meals. This is such an example. In this study, people were motivated to engage in a vegetarian diet by focusing on the benefits to their own personal health, to the health of the planet, or to both. This was a very simple intervention, as you can see here, and it was based on implementation intentions. The first intervention stated you can increase your personal health and well-being if you eat more vegetarian food. The second stated you can increase our planet's health and well-being if you eat more vegetarian food. And the third stated you can increase both your personal health and well-being and the health of our planet if you eat more vegetarian food. You can read more in detail. I simplified it. In terms of practical implications, the findings seem to confirm that policies or campaigns appealing to both personal and planetary health benefits or just to personal health benefits may be equally effective at changing vegetarian behavior. Of course, we can do studies that follow people for a longer period of time, and we can use behavior change techniques that are proven to be effective. Systematic reviews are important to accumulate evidence of this type. Myself and a team of colleagues have embarked in such a systematic review study. The systematic review that myself and colleagues published in OSF revealed that goal setting or self-monitoring of behavior were positively associated with interventions' effectiveness. And so we can use this knowledge that we have to develop better interventions for the future. In conclusion, healthcare professionals are aware of the link between health of our planet and the health of the population. They're aware of the fact that some pro-environmental behaviors can bring health benefits. They are also aware of the barriers that they and their patients face. And future research is needed in terms of facilitating implementation, translating what we know to what is currently being implemented in clinical practice. Also, we need to know what the patients want from the healthcare professionals and what are the barriers and facilitators to approach co-beneficial behaviors in clinical practice. This is research that we need to do. Thank you so much for your attention.